We're back with Dr. Cox. He did a little update for us last week on the coronavirus, and we're just here to talk to him a little bit more about what's going on and to give you parents a little bit more information. So we have a couple questions for you, Dr. Cox, that we're hoping that you can answer. Can you start by telling us what the symptoms are that we're seeing in patients with coronavirus?
So the main symptoms of COVID-19 infections are very similar to influenza or the flu. So the main symptoms are fever, which occur in around somewhere between 60 and 90% of patients, cough, which occurs in around 40 to 80% of patients, and then muscle aches and fatigue would be the other main symptoms. Something to note, at least by initial reports, runny nose and congestion does not seem to be very common. In fact, only 4% of patients with COVID-19 infection have runny nose and congestion. So that can be something to help you to know if that's something you need to be concerned about.
Great. So if my child has a couple of those symptoms, at what point should I bring them into Alpine Pediatrics? Should I bring them into Alpine Pediatrics?
Great question. So if your child doesn't have fever, then they likely do not have COVID-19. If your child has runny nose and congestion, they likely do not have COVID-19 infection. If your child has fever and cough, then call us. We're still seeing a lot of influenza, and it's much more likely that your child has influenza than COVID-19, but we can arrange to have your child seen either through a telehealth visit or as a card visit in those cases.
Is Alpine Pediatrics offering any testing right now?
So testing is coordinated currently through the Utah Health Department. So if we identify a case that we're concerned may have COVID-19, then at this point we're directing them to one of those testing sites to get that test done. That is likely evolving, and at some point we may have testing available, but I want to emphasize that really there's not a huge benefit of testing other than to know that you have the virus. There is no treatment for COVID-19, and it's unlikely that we'll have any treatments available in the next 12 months for that. So at this point, we're testing only very few, and there has been only to this point one confirmed case in Utah.
Great. And then you kind of mentioned that Alpine Pediatrics will be offering telehealth appointments. Those are starting tomorrow. Parents can call in and we can set parents up for a telehealth appointment with one of our physicians. Those are available during daytime hours and will slowly start being available for after hours as well. So thank you so much.
You bet. And we're going to post on our website within the next 24 hours, we're going to post a large list of frequently asked questions. So questions that patients are asking us as providers or asking our triage nurses. We're answering all those questions. We're going to post those on our website and continue to update those over the course of the next few weeks to give you up-to-date answers on questions like, should I take my kid on our planned cruise or our planned airline trip coming up in the next few weeks? Or how are the ways that are most commonly transmitted? What are the ways that COVID-19 is most commonly transmitted? So we're going to answer all those questions on our website, so watch for that in the next 24 hours.
Great. Thank you, Dr. Cox.
You bet, my pleasure.